The healthy immune body possesses a complex and effective defense system known to us as the immune system. The immune system has the task of protecting the body against foreign substances and altered body cells, such as cancer cells. One of the places where the immune system acts is inside our lymph nodes. Here, intruders are recognized as foreign and attacked by an army of molecules and cells. Special white blood cells called T cells or CD4 cells play a key role in fighting off intruders. The body can come under attack by pathogens like HIV, which can severely damage these cells. HIV stands for the human immunodeficiency virus. When the virus enters the body, it attaches itself to the surface of T cells and then begins making copies of itself.
There's two types of HIV, and most people aren't even aware of that. First, there's HIV type 1. That's the type most people know all about, and that's the type most people get. It's also the type that makes you feel ill over time because it wastes your body, it takes away your immunity, and it makes you more prone to diseases. Now, the second type of HIV, called HIV type 2, is similar to HIV type 1, but people do not get sick from it. You can get both HIVs at the same time. And if you have HIV 1, you will get sick, even if you have HIV 2. The bad part is that HIV 1, because it does drain your body and it does make your immune system run down, can cause what is called AIDS, AIDS, the immune deficient syndrome. Okay? And what that means is that these people who have HIV type 1 can get bad fungal infections, they can get bad pneumonias, they can get meningitis, they can have a problem with the virus going into their eyes, into their kidneys, literally going after any organ of the body and breaking it down. When they have this conformation of many diseases together, we call that AIDS. So HIV is not AIDS, and AIDS is not HIV. Most people with HIV, without treatment, without caring for themselves, will progress to get AIDS.
HIV is transmitted via body fluids that contain a large amount of virus. These include blood, semen, vaginal fluid, and breast milk. Methods of transmission with a high risk of infection are unprotected sexual intercourse, drug consumption with used injecting equipment, during pregnancy via the umbilical cord, during birth, or during breastfeeding, administration of blood and blood products, and frequent blood transfusions. Although HIV may be present in the body, it may show no signs or symptoms, and the person may not appear to be ill or even know that their immune system is battling against the virus as it spreads through their body.
When I taught a class a while ago, they asked the same question: how would you know if someone has HIV? And my answer was, look in the mirror. Because most people with HIV look just like you and me. They're healthy, they're happy, they lead normal lives. Having HIV does not mean that you have to be sick, that you have to have sores all over your body, that you have to be so tired that you can't work, that you don't have your mind about you, or that you can't even have children. Because almost all of my patients, especially the women who had HIV, taking their medication, they had healthy children. And the men who had HIV became healthy and strong, taking their medications. And they also fathered healthy children. HIV does not have to make you sick, but the first symptom you would have from HIV would be the same symptom you would have from any virus. And we call that a viral prodrome, and that is, I feel tired, I feel achy all over, and I'm running a fever. If you've had unsafe sex, and within 2 to 3 weeks, you start running a fever, you start feeling achy, you start feeling run down and very tired, then you should suspect possibly you've got HIV as a virus. Absolutely get yourself tested.
HIV blood tests are offered free of charge at the General Hospital and at every medical health center in Grenada, Carriacou, and Petit Martinique. Blood is taken from the arm and sent to the lab for testing. It takes 2 to 3 weeks before a patient receives the result. There are also other types of tests to determine an HIV status.
The type of testing we do here on the island, we have to take a blood sample from your arm. That blood sample is then put through a special test, which takes about 48 to 72 hours. Most people will only find out the results after 1 to 2 weeks because of the time difference in getting the blood to the hospital, till they do the test, till the NIDCU gets the information, and until you get your information back. But there are other ways to test for HIV, and we are trying to bring those down here to the island, and they're called rapid tests. They're also called VCT tests. There's 3 different kinds now, 2 of which are approved by the OECS countries, of which Grenada is part of in the Caribbean. The one type is just a simple blood stick of the finger, like when you're doing a blood test for diabetes. It takes 5 minutes for the results. The second type, which I hope to be getting on the island shortly, is called the OraSure, and there's no blood involved at all. It's a long, special-built Q-tip that you swab the inside of your mouth. And then we put that into a small test tube, and we put a special reagent, and within 5 to 10 minutes, you know whether or not you're positive. Those tests that I just spoke to, the rapid tests, are approximately 99% effective. When somebody shows positive, we still have to take a blood test to verify that yes, they are positive. Now, what does that mean? It means that if, let's say, someone has unprotected sex and they have that last night, tomorrow they could not go and get a test and show positive because a virus takes a very long time to grow inside your body. It has to grow in your cells first. It has to attach to those cells, and then it has to come out into your blood in order for us to find it. So that takes time. And typically when you're HIV type 1 positive, it can take anywhere from 3 weeks, which is very fast for it to grow, to usually more commonly 6 weeks for that to show positive. So that means whenever someone has unprotected sex, they almost should mark it on a calendar and say, I need to be tested within the next 6 weeks so that I give the virus a chance to grow and I then can be sure whether or not this is truly negative. Some people have come and gotten tested too early, and that's a false sense of being safe.
The National Infectious Disease Control Unit, NIDCU, is a department of the Ministry of Health that is responsible for the care and treatment of people living with HIV.
The unit as we know it now was started in 2002, and some of the aims are to reduce the impact of infectious diseases on individuals, families, and society as a whole, and to control the spread of sexually transmitted diseases and arrest the progress of the AIDS epidemic.
NIDCU runs a number of programs that can be accessed by people living with HIV and those affected. The Mother-to-Child Transmission Prevention Program is offered to pregnant women. Expectant mothers are tested for HIV. If found positive, they are given powerful drugs that significantly reduce the chance of passing on the virus to their unborn babies.
We have a mother-to-child transmission program, and clients seen at the antenatal clinics are encouraged to get tested for HIV as well as the other routine tests that are done. It is not mandatory, but we encourage them in the interest of their unborn babies, unborn children, to do so. Of course, it is at no cost to them. The test is free. And once they're diagnosed, they're followed as usual in antenatal clinic, and we see them as well. They're referred to us, and depending on their CD4 count at the time, we can put them on medication to protect the baby from HIV infection. I can safely say that it has been a success. It's a success story, actually, because since we've had medication, medication has been available, all babies born to HIV-infected mothers have so far tested negative.
Today I decided to get tested to know my status. I chose to take this HIV test today because I want to be sure of my status, where I stand with my partner and with myself.
The VCT program offers voluntary counseling and testing for people considering taking an HIV test. Trained VCT providers counsel before and after testing for HIV, preparing the person for dealing with either a positive or negative result.
We always have information and education. We always have counseling and we have the testing. If a person tested positive, there is a clinic where they can go to get additional information on how to manage the virus, the condition, also to get treatment when it's necessary, because it's not all persons with HIV that have to be put on medication. The CD4 count has to be done, and once that is done, then it is determined whether the person needs medication. So then that will be done. And also there is all the support in terms of helping the person to live with the HIV status. And of course we have other support in terms of assistance for those who may not be able to afford a daily meal or to send their children to school. We have all these things in place. And then we also have education and training for their caregivers, where we assist them to look after the person without additional burden and additional stress on the caregiver. Apart from that, we also have other programs. The Prevention of Mother-to-Child program, for example, where pregnant women are tested, and there too we manage the mother and the baby if they are positive, and if they're negative, as with the VCT, then we help them to try to remain negative through continued counseling and through the risk reduction plan.
What we try to tell persons in planning their risk reduction is that persons who use a lot of alcohol, you come up with a risk reduction plan. And in that plan, you may want to reduce the amount of alcohol that you use. For persons who have a lot of sexual partners, you will want to reduce some of those partners if you know that that is going to put you at risk of becoming positive for HIV. For persons who have sex with different or multiple partners and refuse to use a condom, you come up with a plan as how you're going to reduce your status by using condom. For persons who go to party and use dark colored drinks, we try to tell them, as for ladies, that you try to use clear drinks like Sprite, these type of things in order to protect yourself.
All blood test results are presented in person to the client and not over the telephone. If the result is positive, medication would soon be prescribed.
All the medications for HIV are extremely powerful. Now that's a good thing and a bad thing. They're very powerful because they hit the virus hard. And we have to give you more than one medication. We have to give you medication just as if you would have a home. And when you have your home, you want to lock your doors to keep people out from thieving. So you want to put just not one lock on, you want to put a second lock. You want to close your windows. You want to close your back door. Well, the same thing's true with HIV. Because HIV comes into the cell, we want to close the front door. So there's a medication that deals with closing the front door. Once it gets into the cell, we want to make sure that we can lock the windows. And so there's another medication that we can give that can lock those windows. And third, even if that virus, that HIV virus, gets past those first 2 locks and wants to now get out of the cell because it's been able to make a copy of itself, I can still lock the 3rd door with another medication. And so that's why we give a combination of medications to treat HIV, because we want to make sure we get it in all the ways possible. The bad part of that is that the medications, being so powerful, do have side effects. But then every medication has side effects. And I believe in herbs. Even herbs have side effects. But I need to make sure my patients understand them. And then if they get these side effects, they need to talk to me and they need to trust me so that I can adjust the medication so they don't get those side effects. And at least they can be comfortable with the medication. I know the medication will work by doing 2 things. 1, making their immunity stronger, making their bodies healthier. And number 2, dropping that virus down so low that it's called undetectable. It doesn't mean it's gone from the body. It's just so low that it's undetectable. That's the idea behind medications.
The government of Grenada provides all people living with HIV free medication, and NIDCU runs a clinic Monday to Friday designed to cater for the specific needs of HIV-infected people. For more information, call the clinic at the General Hospital on 435-7151 or contact NIDCU at the Ministry of Health on 440-2649.
I'm on Duavir and Nevirapine. That's for the HIV. I take it 1 tablet, 1 Duavir, 1 Nevirapine in the morning, the same 2 in the evening. So that's 4 tablets a day. One doctor prescribed Neurontin for me to calm the nerves and so. So I take that twice a day also. Right now, where drugs are available free, testing is available free, I think, people, once you know you're sexually active, get tested. If you're tested positive, you're getting free drugs, Counseling is free, and there are lots of trained counselors out there, who might be your peers that, you can sit and talk to. There must be someone you can sit and talk to and, help cheer you up, because it's an emotional something. Once you know you're infected, it acts on you, in your mind. It's more of after the immune system, it's a mind disease.
Adhering to the prescribed medication is essential for a person living with HIV. If medication is not taken as prescribed, HIV can become resistant to the medication and untreatable.
It is very important that patients who are taking medication, all medications, not only HIV medication, adhere to the medication. By adherence, I mean that they must take the medication as prescribed, and they must take the medication every day as they are told. If they do not do that, then the medication will not work if they do not take the medication correctly.
Maintaining a nutritious diet is important for HIV-positive people to remain healthy.
HIV tends to break your body down. So if you want to keep your body healthy, you're going to want to eat fruits that are available in season. You're going to want to make sure that you eat vegetables that are available in season. You want to make sure that you are eating meat or proteins. If you don't like meat because it's too hard for you to digest, then make sure you're eating the beans, the lentils, things that have protein but are perhaps not as hard to digest. Now, it's even more important when you're taking medications to then speak to us as physicians to know what medications you've got to watch what different foods with. For instance, one of the medications we give to pregnant women called Viraceft or Nelfinavir, I recommend that women eat high-fat foods because it makes the medication much more powerful. But if I didn't tell them that, they probably wouldn't do it. So for that girl, I'd say eat all the oil down you want because there's a lot of fat in it, and make sure you take your medication when you're going to do that. But she might be on another medication that makes her a bit nauseous, it upsets her stomach. And I'll say to her, eat a potato chip. It's high fat, and it also coats her stomach. So there are little tricks that we as practitioners can help our patients, but once again, it's a communication. I also recommend my patients take vitamins, especially a multivitamin, something with folic acid, something with iron, but then I watch if they're, of course, sickle cell, then I've got to have that information too. But then also to take vitamin C to boost their immunity.
You're at ground level, and we need for persons like you to take up the mantle and do the ground level work. You're in Paul's, you're in St. Andrews. Go out there and give the message.
HIV awareness programs are held within different communities to boost the knowledge about the virus.
We did not only teach them on HIV and AIDS, but they got knowledge on sexuality and the trends in Grenada where HIV is concerned, stigma and discrimination, and condom management. They were very receptive of the information. Some of them, it was just a refresher, and some of them, it was a first-time experience. We implore upon them to go out there and, as a group, engage their community in the information they have received here.
AIDS is real, and you can't say that this person doesn't have it. It doesn't and discrimination against it doesn't help.
I learned the different type of STDs or STI and how you can contact the disease, HIV and AIDS virus, and the different type of condoms, how they are used.
AIDS is the fourth most common cause of death worldwide and kills millions of men, women, and children each year. You can reduce your risk of becoming infected with HIV by following the easy-to-remember ABC Prevention Guide.
The national theme for 2008 and 2009 is Put the Brakes on AIDS. Put the brakes on, and put the brakes on by A, abstaining. Be faithful, use condom consistently and correctly. Some people don't know the expiry date. Some people don't know it shouldn't be in a hot environment. D, do the test, and if you haven't done the test, you don't know the other person. You don't know your status, and you haven't demanded the test results from the other person. You don't know their status either. Educate and empower yourself. All right, so that's the A, B, C, D, E, and that's how we're going to put the brakes on AIDS in Grenada.
HIV is a reality. I think it's here, it's not going anywhere, and I think once we start really getting out and testing a majority of the population, we're going to see the numbers rise. We already have. Here in Grenada, based on the numbers from 2005 through 2007, the numbers have doubled each year. So it's not going to go away. The second part is that the HIV virus we do have is going to get worse because people who are on medications may not be taking them correctly because maybe they don't feel well on them, so they think they can skip a day or two. And that's no good because then the virus gets smart and it builds a resistance and then it doesn't work anymore. Third, I think prevention. With prevention, we're talking education.
Well, the doctor said HIV is a virus.
If we teach children early what a virus is, by all means, it's going to be much better for them to say, well, wait a minute. I don't want to have unsafe sex. Yes, I love you, but I respect myself. So either I'm going to wait to have sex, or I'm going to protect myself. So prevention through education, prevention through, respecting yourself. And last but not least, I think people need to realize that if someone does have HIV,